of us have experienced what's called as back pain. Pain in the back, pain in the posterior area. Sometimes it can be very irritating, it can be very agonizing, it can be very traumatic, it can be highly painful. What is the reason? What is the cause? What is the etiopathogenesis? Yes, you are right. Back pain can be of two types. One, originating from physical causes. Other, perhaps which is much more important, is the back pain emanating from your mind, from your psychological causes. There is an adage in English, the sorrow which has no ventilation in tears can make your organs weak. The sorrow which does not find a ventilation, a catharsis, an emotional outlet, an emotional catharsis. In tears, in crying spells, it can affect your bodily organs, your stomach, your brain, your heart, your nerves, now your muscles also, your back muscles also. Let me remind you that backache can be again psychosomatic in nature, but doesn't mean that we have to neglect physical causes. Physical causes are of equal paramount importance in assessing a person with backache. A psychiatrist has to be a good physician. He has to know the cause of back pain. You can't just dump that every back pain that comes to him is of psychological origin. No, not at all. It is a wrong diagnostic formulation. The muscular and postural causes. Muscle strain due to sudden lifting, due to sudden twisting, or prolonged sitting also. Prolonged sitting can cause muscle stiffness. Doctors unfortunately are in the habit of sitting for a long duration of time. It's not their habit. The profession demands chartered accountants, doctors, typists, judges. They have to sit for long hours of time. What is the end result? They can end up with back pain. Poor posture. You have to adopt an erect, a straight posture while sitting. Supposing you keep on changing your position like this, drooping shoulders, drooping body, etc., it can lead to an intense or a severe backache also. Weak back and core muscles. If the muscles of the back are weak, if the back is weak, it can lead to backache. Prolonged rest. Some doctors are, if I may say so, in the erroneous habit of advising, please take rest, please take rest. Prolonged bed rest can cause backache also. Be mindful about that also, my friends. Continuous bending, either at home or at office work, continuous bending, that also can lead to a severe backache. Then of course there are spine and structural causes, like for example degeneration of disc. Just as the age advances, we develop atherosclerosis, we develop damage to our nerves. Similarly, there is degeneration occurring continuously in all the bones of the body, and when the degeneration exceeds certain limitations in your back, in your spine, it can lead to severe backache also. It is an aging problem, it is an old age problem. But that doesn't mean we have to hush it off. You have to treat it. You have to give relief to the person who is suffering from backache. The commonest problem for backache is what's called as slipped disc. They keep on saying, Dr. Sahab, मेरा disc slip हो गया. I have slipped disc. Doctors have diagnosed. Hence I got severe backache. Very, very common condition for severe backache is slipped disc. In the medical terminology, it is called as a herniated disc. Spondylosis, very common after 40 years of age. Arthritis, that can cause backache. Spondylolisthesis, what happens in this? One vertebra slips over the other vertebra, and that causes severe, excruciating backache also. We have at the back, no doubt, spine. In the inside spine, we have got spinal canal. Sometimes there occurs a narrowing of the spinal canal. What is it called as? It is called as spinal canal stenosis. That can present with severe backache also. We have seen quite a good number of patients who came to us with backache, and lo, when we made a thorough evaluation, we came to know that they had spinal canal stenosis. We sent the patients to a neurosurgeon, he operated, and they are all back to normalcy. Osteoporosis, especially post-menopausal women after 50 or 60 years of age, they develop what's called as osteoporosis. That can lead to severe backache also. Very excruciating severe backache. Kidney stones, infections, gynecological causes like endometriosis or tumor in the spine, that also can produce very severe backache, my friends. Now, most important is the psychological causes of backache. Stress. Stress can lead to muscle tension, that can lead to backache. Anxiety, depression, all these can manifest only with somatization, with bodily disorder, with backache, with pain in the spine also. Emotional conflicts, what's called as repressed anger. Anger, if not expressed properly, that can lead to a psychosomatic problem, and that can lead to somatoform or psychosomatic pain. More often than not, these patients can present with severe backache also. Repressed anger. When we suppress anger, it is a conscious effort. Without our knowledge, without our thinking, without our feeling, when we suppress it, what is called as subconsciously or unconsciously, the correct word is unconsciously, but they may use it as subconsciously. The suppression of anger, which is called as repression of anger by psychiatrists, that also can lead to severe back pain. Not that these patients do not have pain at all, though it is psychological in nature, though it is emanating from mind, that doesn't mean they are not suffering. They are indeed suffering. Perhaps they are suffering much more severely than a pain due to a physical cause also. Psychological pain, psychological backache can be very, very excruciating, can be very, very severe also, can be very, very incapacitating also. How to prevent it? Maintain correct posture, both while sitting or working. Maintain an erect, correct posture. Never ever sit in a drooped way like this, etc. Maintain a straight, erect posture. That can be the first step for you to prevent backache. Strengthen your back with what? With regular exercises, with regular stretching exercises. Yoga can be a very powerful tool to prevent backache. Extension exercises. Avoid prolonged sitting. After every 30 or 40 minutes of sitting, get up. Either walk for 5 minutes, move around for 5 minutes, engage in some physical activity, then go back to the work, then start sitting again. For what length of time? Again for not more than 30 or 40 minutes in the next sitting also, in the next duration also, in the next session also. Very, very important. What about body weight? People who are fat or obese, who have accumulation of fat in their waist, especially women, they tend to accumulate a lot of weight in their waist. It produces what? It produces pressure on the spine, it produces pressure on their knees, resulting in osteoarthritis of knee joint and pain in the spine also, pain in the back also. Sleep on a firm mattress. Very, very important. Your mattress also plays a crucial role in either eradicating backache or producing backache or ameliorating backache or exaggerating your backache. A proper mattress, and while exercising, while walking, proper shoes are very, very important. If you walk or if you do cycling or running barefoot, it can produce severe backache also. Despite all this, if backache exaggerates, please do seek the help of both. Help of a general doctor who can rule out physical conditions and the help of a maintenance professional who can rule out your other causes for backache like anxiety, depression, or a deluded person. Sometimes people have severe delusion. I have got backache. Physically, structurally, it's normal. But still, there is a delusion in the brain that they are suffering from severe backache. In such instances, the help of a psychiatrist would do wonders. Thanks a lot for watching the video. Please do share and subscribe to my channel. Thank you.